So today I don't have a funny or an amusing story for you. I have a little bit of a scary story though. A friend of mine had sex and was convinced that he's got an infection after that. Now after I repeatedly told him, he went to the doctor. Turned out there was no infection, but he was diagnosed with something called phimosis. Now I had never heard of this word before, so I did my research and was sure that I have to have a sexpert come and talk about this. So this is me, Artika, with another episode of Allo, Ask the Sexpert, where we talk about pleasure, health, wellness, phimosis, and so much more, so that you can have better sex backed by science. So today's sexpert is Dr. Karthink with Allo Health, who is a psychiatrist, and he's also an andrologist, if I'm not wrong. Is that right, sir?
Yes, thank you, Artika.
So that's amazing because I think you're the perfect person to talk about phimosis, right? Would you say so?
Yes, definitely. I would like that to be.
Yeah, no, I'm sure you are. So I think just to start off, what is phimosis? It was like an alien word to me. I'd never heard it.
It's to be really frank, there is nothing to be scared about it, frankly, as you introduced. Phimosis is just a simple genetic condition most of the times where your foreskin of the penis is actually very tight.
Got it.
Okay, so it can either be genetics, most of the times as I told you, or sometimes it could be in elderly people because of recurrent infections or, because of uncontrolled diabetes.
Okay.
Okay. In fact, sometimes people come to me with phimosis, and the moment I actually test them, turns out that they were actually diabetic who have never been treated.
Oh, right.
Okay. So it's something very simple, nothing for you.
Right.
I mean,
to be scared about.
Yes.
Okay, so I think that's a very good fact to put out right at the beginning. There is nothing to be scared about, and now we can talk about it more.
Yes.
So, like you said, it's genetic and it can also be age-linked.
Yes.
So, I'm just wondering, is it possible for someone to have phimosis and not know it for a long time?
Yes, possibly. Now, when I actually talk about phimosis, see, the moment you recognize that you have a problem, only then the person is actually going to know. If that problem is actually causing him some kind of discomfort, that is when you actually realize that he has a problem. Now, in phimosis, there are grades. Let's say, when technically speaking, the foreskin has to move back completely during your intercourse or whenever you get an erection. Yeah. That is a fact. Now, if it doesn't do that, then there is a problem. But there are degrees of phimosis where, foreskin sometimes moves back only half.
Okay.
It's a milder form. Or sometimes it is so severe that the foreskin does not move back only.
Right.
Ironically, this most severe kind of phimosis where the foreskin does not move back goes unrecognized because people do not think that they don't have a problem. One, because whenever they get an erection, they feel pain only if the foreskin moves back partially. Okay, in a normal person, it moves back completely, so he will not have pain. Yeah. When it moves partially only, there is stretching of the skin which leads to pain. So that is when he recognizes. In these cases where there is severe phimosis where the foreskin does not move back, the patient does not recognize that he has a problem. Everything goes on as usual, except that he'll have some problems while passing urine. Okay. His erection would be slightly lesser. Ejaculation timing would be slightly lesser, but then he is used to it. So that is why sometimes he doesn't recognize it.
Oh. With anything that we acknowledge as a medical concern or a condition, for example, phimosis, even if we say it's genetically linked, we, I think, have certain questions in mind. One of them being, what are the causes? When you say genetic, of course, that puts forth some answers to that, but what are the causes?
One, as I told you, is genetic. Second, see, skin is a very elastic tissue. Right. Okay? It has to stretch. Sometimes when there is recurrent injury, let's say, you're playing cricket, you had an injury, or you've been having vigorous sexual activity and there is injury to the foreskin, or there are recurrent infections. Let's say these infections are common among diabetics. Okay. So every time there's an injury, our elastic tissue is actually replaced by its fibrous tissue. In the sense, your rubber band is getting older. It cannot stretch too much. So when there is recurrent injury like this, when the entire elastic tissue is replaced by your fibrous tissue, there is no stretching of the skin. Okay. So that can also cause phimosis.
All right.
Although, let's say, phimosis as such is not a major concern. Okay. But what we are concerned more is called as paraphimosis. Okay, that is a condition which is a complication of phimosis where the skin goes back. This is usually found in the mild to moderate cases where the skin goes back and the person forgets to pull it back in the front after sexual activity or just sleeps off like that. and the moment he gets up next day, there is full swelling because the blood that is coming to the front part of the penis, let's say to the prepuce, is not going back. Okay, so it is filtered, it is going back, but somehow some amount of blood is actually left there in simple terms. Okay, so that leads to a ring formation and swelling. Okay, if you leave it like that, then it can actually lead to gangrene. So those kind of
gangrene.
Yes, because of reduced blood flow to the part which is actually distal to the obstruction, away from the obstruction, let's say. Okay, so that has to be operated on an emergency basis.
Right. I'm so sorry, we'll get to that, but I didn't want to break your flow. What was that word against paraphimosis?
Paraphimosis.
Paraphimosis.
Yes.
Okay. I kind of missed it, and I would just love for everybody else to know it as well. And picking up from where you left off, I think we moved into treatments. That A, it may not be a concern for a lot of people, and B, if it's a concern, there are treatments available. Is that so?
Yes.
Okay.
See, first thing what you should realize, there are few organs in the body which are waste, okay, even though they are God given. One is the appendix in your abdomen.
Like vestigial?
Yes, vestigial organs, okay. So, whenever I operate any patient for anything inside the abdomen, complementarily his appendix is taken off. Okay, why? Because appendix always leads to a problem. There is no use, but if there is something, it leads to a problem. Appendicitis, which all of us know.
Yeah.
Same way, our foreskin is also considered the same. It is waste. Okay, now as you know, in few communities, it is done as a sunnat. What we say, like let's say among the Muslim communities, which is being done regularly, all their children should undergo sunnat. Okay, which is actually in a kind, it's a good way. I mean, it's a good thing to actually avoid any kind of complications, because scientifically this is a waste part of the body. You don't need it. There is no use for it. So you actually take it off. Same way, phimosis, there is no other cure. There are no medicines. Now, in market you get lot of ointments which they say, you apply this, pay us, these many thousands, you apply this for 3 months, your phimosis will get cured. All such treatments are available if you Google. But frankly speaking, none of that are scientific, none of them work. Okay, so if there is a tight foreskin, the only short way to get cured of it is your circumcision and frenuloplasty, which is a surgery where you remove the foreskin.
Got it.
Okay, because if you leave it like that, then as I told you, there are a lot of other complications. One is paraphimosis, which you already mentioned. The second one is recurrent infection. So naturally, even if you are mild phimosis, you have very mild pain while having sexual activity. There is stretching of the skin. Now, skin is a protective organ. It prevents us from having an infection.
Right.
So whenever I have sex and if there is stretching of foreskin, then there is an injury in the skin where there is a tear. So bacteria can easily enter your body, and there is recurrent infection in that part. So as time goes by, it just becomes severe. So if you're facing any kind of such issues, even though it is simple, I think you should get operated.
Right. And again, this is something that you should go into a doctor's consultation and then kind of reach this place of understanding what your phimosis is like.
Yes, definitely.
I think you already covered what my next question was, which was about pain during sex and phimosis. So that is a possibility.
Yes, definitely. It is one of the most common complaints among people with phimosis, and that is how we actually recognize them.
Right.
But as I told you, it is more common in mild to moderate cases where the skin is stretched. Okay. So as such, and apart from only pain, as I told you, since there is a pain is actually protective for the body. So whenever there is stretching of skin, the body recognizes that there would be a damage.
Right.
So it has to get down the erection just to protect you from that kind of pain. So the brain actually makes you ejaculate very early, and your erection probably would have been far more better without a phimosis if you're actually surviving with it. So the bottom line is, if you actually get operated, you kind of can have a better sex life than what you're actually having at present.
Okay, post an operation.
Yes, and actually the surgery also, the moment we say surgery, like as I told in the introduction, people are very scared of it. But this is a daycare surgery. It hardly takes 10 to 15 minutes.
Right.
There are no complications. The only thing being that you have to abstain from your sexual activity for about 6 weeks, because you naturally need to give time for the
recovery.
Wound to heal, the surgery wound to heal. Otherwise, it's a complication-less surgery, nothing majorly to be worried about it also. It's done by first year MS students also, if given a chance. That's simple.
Okay. And I think also just asking for people who are trying to conceive and may have phimosis, is there an effect on fertility?
See, naturally it doesn't affect your sperm count or motility. But when there is severe phimosis, sometimes when you ejaculate, the sperm is stored inside your glands, inside the penis only, because it's not coming out easily. The sperm is not like urine, is almost like water. So it might come out. Although some phimosis patients, they might have difficulty in passing urine as such.
Okay.
Okay, at that time they'll naturally recognize it and they would consult a urologist and it would be operated. But sperm, when it comes out, is kind of thick, not really simple liquid.
Right.
Okay, so when you ejaculate and if you have severe phimosis, sometimes the sperm you will not even pass on your semen to the cervix. Okay, so yes, it might lead to infertility. Rarely, but not per se because of the reduced quality or quantity of sperms, because the man is failing to deliver the sperms to the cervix.
Right. No, that was absolutely so well put, and I think it answered all my questions. And that is the end of my list of questions, but I do have some more questions for you. So I'm going to take you to our next segment called Ask Your Question. Lots of people send us questions and we collect the questions anonymously actually. If you want to send a question, you can drop it in the link in this description. So can I take you through some of those questions?
Sure, definitely.
Okay. So the first question is, my penis hurts when I try masturbating. Why is this happening?
Yes, there could be there are a lot of reasons for this. It could be a simple infection, a simple urinary tract infection can also lead to. What you need to do is actually you need to examine yourself and see if the foreskin is moving back and forth easily. If you Google, you get a lot of videos, a lot of animated videos or images where you can actually recognize whether you have phimosis or not. If at all you doubt that there is a tight foreskin which is leading to this pain, you need to go consult a doctor.
And could it be because of something else as well?
Yes, it could be, as I told you, it can be a simple urinary tract infection. It could be an injury to the penis.
Yeah.
A lot of other reasons could be there.
Yeah. Great. I think we just talked about circumcision and that's what the next question is about. The question is, I am not circumcised. Should I be?
Not necessarily. If you don't have phimosis, if it's not leading to an issue, then there is no need for you to get circumcised. But yes, if you feel you have a doubt or if you are feeling any kind of pain during sexual activity or if your foreskin is giving you any kind of pain, let's say, some people might have gone through herpes infection in the past. Right. Herpes is some virus which keeps on infecting you repeatedly. Right. Infections come, go. Every once in 6 weeks, you start getting lesions on your penis. As I already explained it to you, every time there is an infection, the elasticity of the skin reduces. So in those cases where there are recurrent infections, as prophylactic, in the sense without any problem, just to reduce the future problems, we kind of tend to operate and remove the foreskin. Getting yourself circumcised is always beneficial in a way that you are avoiding any kind of future complications. But it is definitely cannot be blankly recommended to everybody, just go get it done. If you do it, if there is any other problem that it is leading to, then get it operated. It's as simple as that.
Yeah. Right. I think this is also coming from a place where a lot of people are like, oh, circumcised penises are cleaner. So I think that's where the question is also coming from. The third and the last question is, my penis looks very different from porn videos. Is something wrong with me?
Now it depends on what kind of porn video you saw. Basically,
but it could just be a difference of representation as well, right?
No, that takes it to a totally different topic. Whatever you say, in porn videos, first you have to realize they are taken in shots.
Exactly.
Nobody can stay longer for hours and hours together. Second, sometimes it depends on the ethnicity, the length, and all these things. Yes, most of the actors have been circumcised. That is in order to just cosmetically make it look a bit better and a bit longer. That's all. So if your penis is not doing its job properly, if you're able to have proper sexual activity, I don't think you should be worried about it.
Right. No, I think that's a really good way to wrap this up. That was the last question that I had for you. I had such a wonderful time talking to you today. I hope you liked it as well.
Yes, nice to touch upon few things which people don't know about.
Yeah, it was really great doing that as well. So this is the end of today's episode. I do want to remind you all to keep writing to us because we love reading everything that you send to us. And this is Dr. Karthik and Artika signing off. We'll see you again with another episode very soon. Until then, take care and bye.